Welcome back. We're seeing empty store shelves yet again, this time not for toilet paper or baby formula. It's a shortage of children's medicine. Parents are scrambling to find Tylenol, Advil, and Motrin as their kids come down with that triple-demic. We're calling it a flu, COVID, and RSV. My next guest tracks shortages for a living and says the suppliers are not prepared for the spike in demand, and there were no stockpiles as drug makers aren't incentivized to make extra of these drugs at low cost. Joining me now is Aaron Fox, Senior Pharmacy Director at the University of Utah Health, which runs 5 hospitals and 16 pharmacies. You are the shortages guru, Aaron. You are exactly the person to speak with about this. And we've had shortages of kids' medicines like Tylenol back in 2018. So why now?
You know, it's the perfect storm, right? We have suppliers who really weren't ramped up for this kind of a demand spike. And we also have supply chain challenges with, not enough staff to stock the shelves, not enough drivers to drive the supply around. And so we're seeing those empty shelves.
Yeah, but I understand if demand goes up a little bit. I mean, what are the numbers here? Did demand spike to an unreasonable degree? Should we not have expected the supply chain to keep up, or should we be furious that these supplies simply aren't there?
I think we need to expect more from the drug manufacturers. This is unfortunately similar to other shortages that we have all the time in hospitals. We see not enough product, very just-in-time manufacturing, and really just a lack of planning and a lack of willingness to have resilience in their supply chains.
It would have been nice if one lasting effect of COVID was the ability at a national, regional level, whatever it is, to mobilize infrastructure to quickly supply whatever we might need in the medical world. Will we ever get to a point like that?
I hope so. COVID has really started the conversation around supply chain. So we're talking more and more about it than we ever have. I've been tracking shortages for 20 years, and this is progress, even though we have empty shelves.
What should I tell all the parents in my neighborhood who are scrambling to say, okay, I'm trying to, when are these supplies going to be replenished? We have text groups going where people say, hey, the pharmacy in the next town over, like they have 8 things of this medicine, I can buy them for everybody if you want. Like, there's a lot of this kind of behavior. What's the advice to people?
It's, take a deep breath, make sure you have that plan with your pediatrician about, when to give medicine and what dose. Also, different products are going to be available. And so that product that you're used to buying might look a little bit different in a store brand, or vice versa. If you're used to buying a store brand, you might have to buy a brand name product, but your pharmacists are there to help as well. And so, talk with them about options, and, try to be patient, and then resist the urge to maybe grab that extra bottle for yourself, so that someone else can also access the product.
You think an executive order would fix this? And if so, if it requires drug makers to have extra stockpiles or something like that, and believe me, I'm painfully aware of how quickly this stuff expires, but would that raise the cost for everybody because we now have to subsidize that extra production to have a stockpile?
Potentially, but I think there could be a rotating stockpile. We just need to pay more attention to it. An executive order could also give the FDA more visibility when companies are having demand spikes. So right now, the FDA is really blind, and they can't do things to try to help ramp up supply and help other suppliers make up the difference. And so an executive order could help, but also government certainly has a role to fund perhaps a rotating supply where the product wouldn't expire, but we might have a longer runway when there are these glitches or demand spikes.
Can I use expired medicines? If so, for how long? And I noticed that you guys at the University of Utah are even crushing up, tablets, for instance, to try to give them from the adult patients to maybe the children. What are some other ways, extending past the expiration date, using adult medicines? What are some options for people?
That's where having that conversation with your pediatrician is so important. There are lots of pharmacies out there that can compound product by crushing up medicines or just making a solution out of powders. And so that is another option for people. It might be a little bit more expensive from those compounding pharmacies. Advice on using expired medicines is really hard. don't necessarily recommend it, especially because these liquids, they do have a short expiration. They can potentially be contaminated depending on how they were stored. And then when you use an expired medicine, you're in that really tough situation of not knowing if your child is not improving or if the medicine just didn't work. So I would not recommend, using expired product just because of that. It's so tricky to know if your child is truly getting the benefit of the medicine or not.
Yeah, and then you watch him spit it back out, and it's dribbling, and you're like, no, this is such. So, final question: how close are we to a crisis point? I mean, a lot of parents feel like we're already in one, but I mean, what would happen if these shelves, and especially once people are overstocking, if they really run dry and we face a situation where this won't be alleviated for quite some time?
I think we're in a good situation with the shortage in that it is a demand spike. That means that the companies are already ramping up. They've already known that they need to improve their production and really make more. With most shortages, it's actually a quality problem that can take years to fix. We're not in that kind of a situation right now. So that does allow the drug companies to ramp up that production. So I don't think we're going to be in a year-long shortage, months-long shortage. Overall, things should really start improving over the next few weeks to a month.
All right, I hope. Erin, thanks so much. Again, you guys have a great website, ashp.org/shortages, if people want to look it up for themselves. Erin Fox, we appreciate your time.
Thanks for having me.